Seems to be the problem.
I don't know what's wrong with my child. In the middle of talking, she'll just zone out like she's daydreaming. But then she'll go right back to what she was talking about before.
Sounds like she's having some trouble paying attention.
And it happens in class too. I have trouble paying attention to the teacher.
It happens so often that the teacher has even expressed concern.
Okay, well, we can test it for ADD or ADHD.
That'd be good. Thanks.
I tested my patient the other day for ADHD, but the results came up negative. I can't figure out what else it could be and why she's having so much trouble paying attention.
These are her results? You tested her for ADHD? Where'd you get your medical license? App State? Remind me why I hired you again?
Well, I don't know what else it could be.
Well, look, ADHD causes distractibility, so that would explain her trouble focusing. But does she show any impulsive behavior, trouble withholding responses? Can she still plan ahead? What are some of her other symptoms?
Well, her eyes tend to twitch when she zones out, and I guess she doesn't respond when her name is called. That's an important stimulus. It seems like she's daydreaming, but she can rejoin the conversation pretty easily. She just misses whatever part happened while she was out.
But does she even realize why any time has lapsed after these daydreams? They only last a few seconds, and then she's focused again. That's not a daydream, genius.
So, how was school today?
School was great. We talked about math, and we went over a little bit of English.
And continue.
And science, and maybe history. Did a little bit of everything. Class was great, except that I don't remember the specifics.
Okay.
Could she be having absence seizures?
Thank you. You finally discovered the problem. Perform an EEG on your patient. Show her flickering lights to provoke a seizure. That way, this EEG will show different brain patterns when she's having the seizure, so we can confirm that's what she's having.
Good news. We figured out what's wrong with your daughter.
Yeah, is it ADHD?
Well, no. Actually, she's having petit mal, or absence seizures.
What are you talking about? My daughter isn't convulsing.
No.
You must be getting your patients confused. She is not having seizures.
Well, no. You're thinking about grand mal seizures. Not all seizures have convulsions.
Well, what is a seizure?
Seizures are characterized by an overstimulation of the brain. They're an excitation of neurons, which can occur anywhere. There are two main types, generalized and partial, which refers to how much of the brain is involved in the seizure. The two types of generalized are petit mal and grand mal.
So which one refers to the convulsions?
Grand mal seizures. They're the most serious, so they tend to be the most well-known. In grand mal seizures, the motor cortex tends to be activated as rapid neural firing spreads throughout the contralateral cortex, thalamus, basal ganglia, and reticular formation.
The what?
Well, basically, a seizure will start at a certain focus, but generalized seizures spread throughout the whole brain, so it's difficult to determine the focus. Grand mal seizures are also called tonic-clonic seizures due to their two stages. The tonic begins the seizure, and it involves muscle contractions and lasts about 15 seconds. The clonic phase, muscles start to tremble, and that lasts about 30 seconds. A person won't breathe during either phase, so the brain loses oxygen.
Well, that's really interesting and all, but what is going on with my daughter?
Right, well, absence seizures, like I said, aren't nearly as serious, but there's not much you can really do for them.
Well, doctor, isn't there any kind of treatments? My teacher writes bad reports on my report card. She says I'm unmotivated.
Or are there any drugs she can take?
Well, not exactly. Those who have more serious seizures can take inhibitory drugs, but they impair cognitive function. Anticonvulsants are also taken, but she's not convulsing. And if they're caused by scar tissue buildup, then we can cut out the scar tissue, but we'd have to do an MRI to see that.
But I don't have any previous head injuries.
Okay, well, she can change her diet. We're not exactly sure why, but a high protein and high fat diet or a ketogenic diet tends to reduce seizures. But your daughter will be fine. As long as she is aware of the seizures, she can have people repeat what they said after they occur. Just let her teachers know that she's having the seizures. That way, when they occur, she can just ask them to repeat the information to her.
Okay.
People with absent seizures can live relatively normal lives. They start between the ages of 4 and 14, and sometimes they can even stop by age 18, 70% of the cases.
Great. Well, thank you for all of your help.
Thank you, doctor.